Hi, I'm Dr. Ethan Johnson, host of the Healthy Seminole Show. In this show, we are focusing on chronic diseases which affect so many lives in our community. Most chronic diseases can be prevented, and there are resources that can help manage the disease if you've already been diagnosed. It takes a team and great partnerships working together to support healthier lives. Hey everybody, today we're joined by Lieutenant Kurt Helcom from the Community Paramedicine Program. We're excited to have you today.
Thank you.
Yeah, thanks for joining us. So just for starters, what is community paramedicine?
Well, so community paramedicine basically it's both reactive and active to 911 calls, right? So to get in touch with our residents, through our 911 system, we had a series of not repeat callers, but people who would call 911 a lot. And so we found that we had some that would call 12 times in a quarter, some would call 8 times in a quarter, and what was causing that, right? So we had to find out why those people were calling us 12 times and figure out how to do that. So we built this community paramedicine program to go into those homes to find out what we were missing. What was missing in their home, what were we missing on the EMS calls. And a lot of times it's a fall issue, heart disease, all those things. So the EMS would let us know that we have this person that has issues at the home, and the community paramedicine goes in and evaluates the home for safety, falls, make sure they're doing the medication correctly, social, all that kind of stuff. And we designed a plan to work to where we could go into their homes and alleviate all those calls to 911, not all of them, of course. If they're emergencies, please, by all means. But if they were tripping and falling 10 times a year, we try to solve that tripping problem. We try to solve that fall problem. If they're not taking their medications correctly, we try to educate them on medicine reconciliation. Mm-hmm. So it's just a big process of sitting down with somebody like in your family, mm-hmm. like, hey mom, are you doing everything correctly here? Or what's going on? And so it's a really social level program that works with the resident, we don't call them patients, mm-hmm. that helps better guide their future in their health care. And so I really like it. It's pretty interesting.
Right, so you're impacting patients, but then you're also having a positive impact on the system itself when you're
yes.
diverting them away from the emergency room if they don't need to be there.
That is correct, and so that was the big thing. Why are we going somewhere 12 times a year? Is it necessary? And then we find by just intervening a little bit, they no longer are going to the hospital that much. And we ran the numbers last year, and it's just amazing on how the support that we're getting and how it's working well in that field, and it's pretty cool.
Wow. So what would you say are the most common chronic conditions that you maybe encounter with the residents, and what are some of the ways, I know that you mentioned, education and things like that. What are some of the ways you support them through those chronic conditions?
Okay, so the most, it's funny because we start the community paramedicine program, or a lot of places call it MIH now, and they started to help the people with COPD, diabetes, hypertension, things like that. And you find out that the CP really is more involved on a social level and a loneliness issue with these elderly people that are calling us constantly on wanting just the human contact. Mm-hmm. So it's almost a social thing that is our biggest issue, and then we get into diabetes as the second. And a lot of times it comes with those chronic issues where they take medications, just comes with the education. We sit down with them, make sure they're following their discharge program correctly, making sure they're in contact with their doctor. We do telehealth with them. We'll call their doctor while we're in their home, and their doctors are usually more than happy to talk to us. So we welcome anything they want to put into that patient care, and we just try to follow the guidelines that they're given, and then we recheck on them as periodic as we need to. If somebody's not really good at following the course, we try to go maybe every third day. It just stretches the schedule. If they're really good, we go once a week or twice in a month, or it changes. So we found the biggest issue is to be social and loneliness in the residents, and that really causes a big 911 role. It's just they'll call 911 the first time, they get a little bit of attention that they want, and they get directed in the right way for that night, then they call again a week later for the same thing. So we'd like to get involved in those socials early, right. And so we eliminate that and let them know that they can come to us instead of using the crews that is not an emergency situation.
So, and your response to this may be more anecdotal, but what would you say is the biggest change that you've observed in residents after, these types of encounters with them, especially ones that you've had multiple encounters with?
So that's a broad spectrum, because we've seen so much change in the way the residents are responding to this, and even how our medics, we have 4 medics, including a lieutenant paramedic in the program, and how those people that are tending to the visits care. And so we're seeing a huge improvement in health. So let's say we go to, I'm just going to make up a name, Jane's house, and we go to Jane's house for the first time, and we realize that she's not taking care of herself. She's not getting dressed in the morning. She has really not a whole lot to look forward to in her day. But if she knows our paramedic is coming, she gets up, she's happy to see the day. She's waiting for that visit, because now she has almost, not purpose, but she has something to do. And so we're finding a huge, like just a relief of the anxiety and stress issues that the elderly population have. And just the welcoming things, the cards, the thank yous, just the way that the residents seem to be grabbing the program and following our direction and just catching on. And we've seen a huge impact on the reducing calls, the care that they get, the response we get when we walk in the house. It's very positive. It's they're connected to us.
You mentioned this earlier, just the impact of diverting folks away from the emergency departments, and obviously you all receiving less calls because of this program. What is the impact that has on a system?
Well, on the system, on the overall system, over time, it's wear and tear on the trucks. It's wear and tear on the employees that are running those calls. That their mental awareness may not be as good as if they weren't, because they got to run that emergency call, that true emergency call that has to keep them sharp and awake and all those things. And so when you have calls that are repeated that are not necessarily emergent, I mean, we're the fire department, we're there for everybody, but when it's an emergency call, the 2 units usually go out, so you get 5 to 6 people arriving at the home to take care of an issue that may just be medication, or someone forgot to take their medication and they have the anxiety, right? Where that takes a toll, because now you've removed that system, that emergency system that's supposed to respond to a cardiac arrest or shooting or anything that's a true emergent, and you've removed them from their area. So now we have to bring, you just have to balance it out to where the units get stretched out when that happens, stretched thin.
So is there anything else you'd want to add that you didn't get a chance to share about the community paramedicine program?
I guess just how they can get a hold of us, how the community can.
Yeah.
It's through Seminole County government, the website, and you just follow the fire department link, and then community paramedicine. And we're in there, and there are phone numbers in there, they can call that. And then there'll also be a link to our Spotify podcast, which they can listen to get, just kind of listen, and it's kind of relaxing listen to see what's going on.
Lieutenant Helcom, we really appreciate your time this morning, and everything that you're doing in the community. Folks, feel free to visit the website to learn more. We appreciate you, and thanks for coming by.
Thank you, I appreciate it.
Yeah, thank you.
Okay, let's have a real talk about blood pressure. Do you monitor yours regularly? It's something everyone with high blood pressure should do, but it's something most people don't know how to do correctly. Checking your blood pressure regularly will help let you know if you have it under control. It will also help you start to understand which factors are putting you at higher risk for stroke and heart attack. Before I get to that though, I just want to stress one thing. If you have high blood pressure, you should talk to your doctor to figure out how frequently you should be checking it at home. For most people, taking your blood pressure twice in the morning and twice in the evening, even just for a week, will help you and your doctor get a better understanding of your blood pressure. For morning readings, it's best to take those before you take your blood pressure medication. It's also very important to avoid exercise, caffeine, or tobacco at least 30 minutes prior to testing, since those can affect your levels. Now, let's move on to talk about the proper way to measure your blood pressure at home. Nearly half adults in the U.S. have high blood pressure and are at high risk for stroke and heart attack. So self-measuring is one of the easiest ways to be proactive about our health. Here I have my blood pressure monitoring device. It's easy to use and it helps me get an accurate reading. Be sure to get an automated device with the upper arm cuff. That's the type doctors recommend. The first thing you want to do is find a quiet place to sit where your back is in an upright, stable position. A dining room chair is great. You want to make sure the chair isn't too soft so your body is fully supported. Sit with your feet flat on the floor and don't cross your legs or ankles. If you need to use the bathroom, make sure you go before you do your reading. Next, rest your arm on a flat surface with your palm facing up. Place the blood pressure cuff on your bare upper arm just above your elbow. Your arm should be relaxed and resting so the cuff is at the same height as your heart. Now rest quietly for 5 minutes before taking the first measurement. Avoid talking while taking your blood pressure measurement. Once your first measurement is completed, write down the blood pressure numbers and pulse that are displayed on the device. Wait 1 minute and then repeat this process again. As you just saw, it's important to check your 2 measurements at around the same time each morning and evening. At your next doctor's visit, be sure to share your blood pressure numbers so you can discuss the numbers and so your care plan can be changed if necessary. That's it. Not bad, right? Measuring your blood pressure at home is easy to do and a great way to stay on top of your health. If you have more questions about managing or measuring your blood pressure overall, visit the website.
Joining us now is Dr. Corinna Seniors. She's the Chief Medical Officer at True Health. We're so happy to have you here today.
Well, thank you for having me.
Yes, thank you. So for starters, could you tell us a little bit about True Health and the population you serve, True Health?
Okay. True Health is what we call a federally qualified health center. We've actually been in existence since 1977 in the Sanford community. We are a medical office that actually takes care of people from all ages of life. Most of our offices will see patients from age 2 and up, but if we have providers who are comfortable or able, we can actually go from newborns all the way up to our 100-and-something-year-old patients as well. We provide basic medical care, which is, let's say the well child checks, that is, the cough, cold, flu, COVID testing, and checking that. But we also take care of our adult patients with adult visits, pap smears, general exams. But if they have other medical conditions like hypertension, diabetes, we take care of that as well. But again, if you're sick, you woke up sick, you can actually come to our offices. We'll take care of you for that too.
Given the spectrum of services you all provide and the diversity in the clients that you see, patients that you see, what would you say are some of the most common chronic conditions that you come across in your patient population?
The chronic conditions are the same that most people know about. That's hypertension, high blood pressure, for people who don't remember what hypertension stands for. There's people who have high blood pressure and do not even realize that their blood pressure is high. They may not have any symptoms whatsoever, or they may start saying, I'm having headaches, I'm having dizziness, I'm having palpitations, that's when my heart is beating like that. Different things like that. We also take care of people with other chronic conditions, diabetes. We have people who have high cholesterol, cancer, all the chronic conditions that are out there that are affecting anybody are the same conditions that we take care of every day in our offices.
So, and as a clinician, what are some of the ways you help folks manage some of these conditions?
Pretty much everything we do is the same as if you were going to any other medical office. You come in, you get set up with our offices. We put patients, and we'll talk about that another time about, how we do the sliding fee scales. But, if you're coming in to be seen as a patient, you will come in, the medical staff will go over your past medical history, your surgical history, what medications you're maybe taking at that time. The provider will ask you a lot of other medical questions just to sort of see what's going on with you. They'll do a physical exam, where I'm checking your heart, your lungs, I may be checking your eyes, I may be checking your legs, your feet, whatever it is. And then from there deciding, hey, you need to do some lab work. Maybe we need to do some medications. Maybe I need to get you set up with a specialist. I may have some internal specialists I want you to see. Like our diabetic patients, there's a lot of things that we like to do for our diabetic patients that, people always forget about. Diabetes is when your blood sugar is running high, it can affect the nerves, but it can also affect and damage the organs like your heart, your kidneys. It can affect the nerves in your legs, especially in your eyes as well. So what we normally will do is we may set somebody up to go to an eye doctor, or we can actually run some testing in office where we can do eye exams, where we can do, we call it a diabetic retinopathy. Basically, that's just the eye screening. If we need to, we can set them up for a podiatrist. We actually have a podiatrist that comes to our Sanford location, and we can actually set them up for a podiatrist who can examine the feet, make sure if there's any wounds, if there's any ingrown nails, make sure that they actually have good feeling and things like that in their feet. And so, we don't have any issues with that. And if we're not able to do something internally, like maybe we need dental services, we actually have 4 dental offices too. We can set them up for that. But if we're not able to do something, like we need to send somebody to a cardiologist or a lung doctor or somebody else, we write a referral and we can send them outside. But we have some good relationships with our community providers that we can actually do that for too.
That's excellent. So those are really, when we're talking about folks who are already struggling or trying to manage a chronic condition. So what about folks that you encounter who are maybe at risk or maybe borderline, like pre-diabetic? What are some things that you all do or promote in terms of preventing chronic conditions?
Prevention is our number one component. That's one of the main things that federally qualified health centers were created for, was to actually be in the community, where maybe they are not able to get other medical services, and actually try to do preventative care. So again, we're trying to catch people before they get sick. So that's why we always strive to have people come in for annual wellness visits. If it's a person over 18, like you or another young lady or something like that, we want you to come in at least once a year for a physical. That way we can do a head-to-toe exam, eyes, ears, nose, throat, heart, lungs, make sure everything's okay. If we need to order some lab work, if we're suspicious of something, or if you say, hey, I have some family history of diabetes, I have some family history of this, we'll order those labs for you as well. If we're concerned about your blood pressure being elevated, maybe we'll do an EKG. We'll go ahead and do those things. We'll also, depending on the age bracket of the person, we'll also recommend other physical exams or other services. So if you're over 45, if you're thinking Chadwick Boseman and things like that, that's why we strive and stress colorectal cancer screening. That's, of the abdomen, making sure that, we're sending people off for either getting a colonoscopy with gastroenterology, or we may do internal testing. We call it IFOB, or we have Cologuard that we can actually give to a patient, and they can actually do that test at home. We also will recommend for women who are over the age of 40 to start doing their mammograms, for breast cancer prevention. We'll also recommend for women over the age of 18, over the age of 18, I always have to remember they keep changing that statute. But usually for over the age of 18, we recommend starting to do their cervical cancer screening. That's pap smears, checking to make sure. And the thing is, pap smears used to be, we do this every year, with first intercourse, or once they hit 18. But now actually some of the rules have changed. We're actually just saying, hey, you can actually wait to 21, and we're doing it almost every 3 years. But again, that's checking for cervical cancer, because we don't want people to have to die for things that could be prevented. We want to catch things early. A lot of times we take care of people who put things off because maybe they couldn't get in. They didn't think they could afford to come to a doctor, so they may have something going on, but they didn't tell anybody. And so they wait, and by the time we are actually seeing them, maybe they're farther along with their cancer diagnosis or farther along with diabetes or something like that. And so basically we're now trying to catch up and actually treat them medically or surgically for something. But if we can catch them early, do those preventative medicines and, doing all those physicals and things like that on a regular basis, that way it's like, hey, you came in like this, but now you're a little different than you were before. Same thing for kids. We do the physicals as well. We always recommend that, newborns and children have physical exams on a regular basis, at least yearly, so we can actually keep an eye on them. There's times for different vaccines and other treatment options as well. But when kids are getting ready to play sports, we want them to come in for their physicals as well, sports physicals. If they're over the age of 13 and they're about to play, sports, we recommend doing an EKG to make sure that we have all that taken care of as well.
All right. Well, and I'm so glad that you've offered that insight, because I think when we think prevention, we spend a lot of time thinking about, which, as we should, exercise and nutrition, really important in terms of preventing these chronic conditions. But then at the same time, something that maybe isn't spoken about as much is on-time screening. And seeing your physician on a regular basis. That's a huge part in preventing this. And I know not everyone watching is probably familiar with Chadwick Boseman. I know you mentioned him, a young man who died from, was it colon cancer? Colon cancer. And otherwise healthy. So I think that I'm really glad you brought that up. That's such a huge part in preventing chronic conditions, is screening, on-time screening, and kind of staying up to date, which your physician or your provider can help you with staying up to date on those screenings. That's a lot for you to try to do on your own. If someone wants to know more information about True Health, where should they go?
You can actually, there's several different places that you can go. You can go online to www.mytruehealth.org. That's our internet presence. You can actually see us also on Facebook, on social media, also on Instagram, but we also have our main number, which is 407-322-8645. So many ways, social media, on the web, as well as by phone.
Excellent. Well, Dr. Seniors, I truly appreciate your time with us. Thank you for stopping by and sharing all things True Health.
Thank you so much. I appreciate being here. Thank you all.
You can reduce your likelihood of developing a chronic disease and improve your quality of life by making healthy choices. Here are a few tips that can help. Not smoking or stopping if you smoke lowers the risk of serious health problems such as heart disease, cancer, type 2 diabetes, and lung disease. Take the first step and call the Quit Your Weight hotline at 1-877-YOU-CAN-NOW. Eat healthy to maintain a healthy weight. Enjoy a balanced diet of fruits, veggies, whole grains, lean meats, and low-fat dairy products. Practice regular physical activity for at least 150 minutes a week, such as taking a brisk walk, gardening, dancing, or walking your dog. Avoid alcohol. Over time, excessive drinking can lead to high blood pressure, various cancers, heart disease, stroke, and liver disease. By not drinking too much, you can reduce these health risks. Visit your doctor regularly for screenings to prevent chronic diseases or catch them early. Keep your cholesterol and blood pressure at normal levels. Get enough sleep. Adults should get at least 7 hours of sleep daily. Know your family history. If you have a family history of chronic disease like cancer, heart disease, diabetes, or osteoporosis, you may be more likely to develop that disease yourself. Share your family health history with your doctor, who can help you take steps to prevent these conditions or catch them early. Control stress by engaging in healthy activities. Reach out to family and friends or a support group in time of crisis and take time to relax.
We're here today at the Health Department, and I'm joined by Latasha Scott. She's our Director of Nursing, and she is also a nurse practitioner here at the Department of Health. Latasha, thanks for joining us today.
Thank you for having me. I appreciate it.
Yeah, we're excited to talk. So can you talk to us a little bit how the Health Department supports those living with chronic diseases?
So the health department have several ways that we can help those that are living with chronic diseases. First and foremost with education. We do a little bit of screening and of course referrals and resources we provide to them to help them to manage not only at home but also when they come to the clinic. We discuss how they can manage those those chronic diseases on their own and in conjunction with their providers.
Okay, and when you say chronic diseases, what are you seeing most frequently?
We're usually talking about our diabetes, our high blood pressure, our asthma clients, and also we want to do a little bit to prevent and capture those early detection in things such as cancer, uterine cancer, cervical cancer, and we recently just started a program with checking for prostate cancer.
Okay, so we have a mobile unit. And I know you were talking about our clinic, but what type of services do we do on the mobile unit? I know you've mentioned some of them.
Yes.
And how does that kind of work out? Where is the mobile unit?
So our mobile unit, we definitely love it. It's one of my babies here at Seminole. And the good thing about the mobile unit is that we take the services to the client. So when we're out on the mobile unit, we're providing services through screenings and testing for individuals to make sure that not only are we helping them to identify if there's a potential risk, but if they do actually have a diagnosis, again, we link them to care with providers in the community.
Mm-hmm. So in one of our recent discussions, you were describing to me about how we're finding a lot of folks that have high blood pressure.
Yes.
They don't even realize it when we're out in the field and screening them. Sometimes they're in hypertensive crisis at the time of screening.
Absolutely.
Why is it that so many people are either unaware or maybe indifferent about
well, I
issues
think
like that?
especially for high blood pressure, it's called the silent killer for a reason, because many people don't realize that they may be having symptoms, especially subtle symptoms like a headache. A headache can be anything, but it's usually one of the first signs of uncontrolled high blood pressure. So that's why we're out in the community to check those blood pressures, to check those glucose testing. We also do actual hemoglobin A1C testing as one of the key tests for identifying someone with diabetes. So once we do find those individuals who may not necessarily need medication right away, but they may can help help with different lifestyle changes. So we provide the education, the diet. We have classes called the Diabetes Empowerment Education Program, in which those individuals can participate in a class and learn how to help manage and minimize the risk for diabetes, which also links to high blood pressure, right? So even following that diet and change of lifestyle can help, you know, to potential risk areas, whether it's high blood pressure or diabetes.
I think earlier you mentioned prostate cancer screening or PSA screening. How long have you all been doing that, and you know, what is the impact of being able to provide that in this community?
So we kind of scratched the surface with the PSA prostate testing last year during our Men's Health Month and also our Prostate Awareness Month in the community, and we saw that it was such a great service and people really enjoyed it, and they were thankful that they were able to, you know, to do that, because nowadays men do not like the traditional screenings for prostate. They'd rather have the blood test done.
That is true.
So one of our partners here, our programs here in DOH, received some grant funding and asked that we'd like to increase that testing here, which we were happy to do so. Starting with June being Men's Health Month, we are prepared to provide that free of charge for men who qualify, or even those who are at high risk who would like to have the prostate testing done. And again, we have been able to identify individuals that may not necessarily have prostate cancer, but those tests are indications that something is going on that they need further testing.
Okay. So I know, switching gears a little bit, depending on the chronic disease, there are different risk factors, but generally speaking, we hear about nutrition, diet and exercise, you know, we hear these things, but what are some other things that people need to keep in mind in terms of preventing or even managing chronic disease?
I think for me it would be the screening and testing, because even if the risk factors that people may feel they're normally there are not there, anything is possible. Also the family history that could be there that they may not be aware of. You know, everyone is not aware of their family history, but keeping up to date on the screenings.
Absolutely, absolutely. So if someone in the community wants to be connected to one of the programs that you mentioned, what would be the best way for them to do that?
I would say reach out to Florida Department of Health in Seminole. Just give us a call, or you can go on our website. All of our programs are listed there. Reach out and let us know that if you have any questions. We don't mind answering questions. If you want to just come by and say hi, we will make time to discuss with you what your needs are and meet those needs.
Well, that's excellent. Latasha, thank you for your time.
Thank you. Thank you.
I hope you enjoyed today's show as much as I did. Remember, diet and exercise are very important, but also getting those preventative screenings on time are key to preventing chronic diseases. So I look forward to seeing you next time, and special thank you to our guests. Take care.